Today I've been dispatched to Emerald Lake. The dispatch code was loss of consciousness. Okay, so I've arrived here. I found my patient lying on a rock. Immediate concern is the ABCs, so is her airway open? Is she breathing, and has she got circulation? Is she bleeding?
I fell down. I don't know, I might have, my head feels a bit sore. Maybe I hit my head, I don't know.
Okay, so sounds like a potential loss of consciousness before the fall, and sounds like they've possibly hit their head. So immediate concerns would be bleeding and possible stroke. So ask, are you bleeding anywhere?
Not that I know of.
Do you mind if I have a look at your head?
You can look, it's just cold.
Okay, I'll be as quick as I can. No blood. Let me ask you a few questions. Can you open your eyes and look at me?
Yeah.
Can you smile? Can you just hold my hands here? And can you give them a good hard squeeze, both hands at the same time? Her speech is not slurred. Before I ask her more medical questions, they're going to assess her 12 cranial nerves. Zip your shirt.
Yep.
So, just need to, can I feel your neck?
Yep.
Yep. I'm just going to feel for any irregularities. Have you got any spinal pain?
No.
Very good. So I'm just feeling up and down the C-spine. Of course, ask her if she's feeling any numbness or tingling. Can you check your leg here?
Okay.
Can you move both legs for me? So her spine seems to be intact, so I can continue my assessment. I'm going to start with the first cranial nerve, olfactory nerve. Can you smell? Very good. So I'm looking for any deviation and tremor. I would shine a light now and check for pupils. Your face?
Yep.
I'm just going to feel just behind here. I'm going to get you to clench your jaw for me. You clench your eyes really tightly for me. Any pain?
No.
No. Swallow for me. Head to look at the lake for me. Yes. Very good. And can you shrug your shoulders for me? I'm just going to need you to just walk a little bit for me.
Walk.
And we're going to assess your spine. How are you feeling?
Yeah, I'm feeling alright. Can you walk straight? I can walk. Yeah. Do you mind if I feel down your spine? No, that's okay.
So, looking for irregularities. Feeling dizzy at all?
No.
Okay. Assessing memory, so retrograde memory, which is memory of what happened before the accident, and anterograde memory, which is what happened after the accident. So I asked her what happened.
Remember the beautiful, taking some photos of the beautiful emerald lakes. Yeah, beautiful. I'm going to show my grandchildren.
I just need to ask you, don't take offence, but I'm just going to ask you something common.
Hope it's not too personal.
Just a common article, see if you remember what it is. Do you know what this is?
Looks like a sulfur rock.
You passed that test.
That's sure.
Have you had a stroke before?
No.
Okay. Illnesses in the last while? Any major illnesses?
No. No.
Are you on taking any medication at the moment?
Well, just for
Okay. We'll get back to that. And also, how long have you had diabetes for?
about 2 years.
Okay. Have you been meeting your target for your blood glucose level?
Yes, I usually am pretty good about it.
Mind if I test your blood glucose level now?
Okay, no. Okay, you can go ahead.
Okay. Eating and blacking out could be caused by hypoglycemia. Have you been eating normally since?
Yes.
Yeah. When did you last eat?
Oh, lunch. We had a nice lunch.
As I've been asking her questions, I'd also be getting my partner to be checking vital signs on her just to see if vital signs are normal. Abnormal vital signs is one of the red flags for syncope and for loss of consciousness. Okay, so just a quick little prick that is within the normal range. If it was, I would be treating her with glucose gel, and I would give her that's 3 mils, and I would check her BGL once again in 10 minutes just to make sure that the blood glucose has gone up and is staying at a manageable level. It is a normal GCS. Blood sugars are normal. My working diagnosis is that she has fallen and hit her head, therefore she has had loss of consciousness. It is unsure whether she had it before she fell or after. So as she is diabetic, she has a 3% more chance of having a stroke, and so she is in the risk category. Other risk that would cause greater damage is if she's taking alcohol, if she's on anticoagulants, and if she's older than 65 years. So I've been dispatched to a remote location in the Tongariro National Park. The patient is presenting with a normal GCS of 15, no loss of consciousness at the time of my arrival, and no sign of seizure. I'm going to be immediately thinking about extrication and assessing this patient as thoroughly as I can to make sure that there is no neurological damage. The common causes of loss of consciousness are stroke, syncope, transient ischemic attack, and traumatic brain injury, hypoglycemia, and poisoning or toxins. These cover the ranges of neurological and endocrinal body system, and this is what I'm going to be assessing today. For my neurological causes of loss of consciousness, I have stroke, syncope, traumatic brain injury, and transient ischemic attack. For stroke, I have done a FAST test and also a comprehensive 12 cranial nerves test, which is appropriate for assessing all of these neurological causes. For traumatic brain injury, I have assessed the head as the patient fell, and I do not see any bleeding or contusion to the head. For transient ischemic stroke, the indicators that a patient has had a transient ischemic stroke is and also a low GCS and problems with memory recall and balance. I did a balance and memory test as well to rule out transient ischemic stroke. For SP, I have ruled out loss of consciousness at the time of my assessment. Her GCS is normal. I've looked at blood pressure because syncope is a lowering in blood pressure causing syncope or loss of consciousness. Literature states that you need to always assess the blood glucose level when a person has had loss of consciousness. Ruling out hypoglycemia, I did a BGL test, and I also questioned the patient about whether she's been meeting her target blood glucose level in the last few days, whether she's been eating normally when she had her last meal as well. To rule out toxins, I was looking at environmental toxins in the area. Was any smoke, any excessive sulfur, or any kind of toxin that could cause loss of consciousness. I was also questioning her about her medication and ascertaining whether she has taken an overdose. The loss of consciousness, there is a number of red flags which cover the whole list of common causes of loss of consciousness that I have just mentioned. These include abnormal vital signs, failure to recover, abnormal 12-lead ECG, clinically significant pain, signs of stroke, signs of injury, inability to mobilize, pregnancy, headache, new or unexplained shortness of breath, congenital heart disease, if this occurred during exertion, which it did. In conclusion, my working diagnosis is that the patient has had an episode of syncope upon exertion on the Tongariro track, and as this is a red flag, I would advise that the patient is transported to hospital as soon as possible.